Now, for the last 60 days, I've been traveling around the world 2 times. And been going around, and I only stay in 2 days, the most in every country. So this time I was here for more than 4 days. So it's quite a long one. I'm moving to Japan again for the second time in the last 60 days in the next few hours. And there I'm having a press conference with the press to issue the first stem cell book in Japan for all the doctors in Japanese. And of course, as an author of more than 40 books published in UK and contributing to the first stem cell book of the world in 2006, published in USA for medical doctors, I would say life is a learning process, and the best doctor is still yourself. So you have to be educated to understand more about yourself and to understand more about what is really stem cells and cells. Everyone is thinking a lot about the stem cells, and stem cells seems to attract a lot of attention. In fact, you all have stem cells in your body. If you don't have stem cells in your body, you won't be around anymore. The only problem is you are born with 37.2 trillion of live cells in your body. So what is the difference between cells and stem cells? Now, cells, just imagine them as the bees. And then you have a super cells, we call them the stem cells. So that is the queen bees. So we are born with 37.2 trillion of live cells, where you have some small amount of stem cells. It will be 1 over 10,000 live cells when you're born. But we all age at a very fast speed. By the age of 60, you only have 5% left of your stem cells, and that will be 1 stem cells over 800,000 live cells. So imagine we are going so fast at the speed, we obviously have to do something. We are talking about longevity. Americans are very looking at longevity all the time. The whole last 1 year here, where I've been down here in USA, I come to realize a number of conferences where I was the speaker, they talk about longevity. So everyone wants to extend life. Of course we want to extend life. We come to realize over the century, we all live longer. Technology changes, so obviously we live longer. Mortality rate is at a longer time. Now, what's the point of extending longevity, extending our lifespan, if we don't have the quality life? So the quality life is important. So you must extend quality life into longevity and not just add years to your life. I always say that. So what is quality life? Quality life means you can enjoy what you want to do, you can have something you like, you live life to the fullest. Now, quality life means you must have good health. And that will have to go with a way to do some reversals of your aging organs. You have 78 organs in your body, and the most important organs is obviously the brain. And every organs are aging so fast that you don't even realize it. For example, you start to lose muscles at 30. You start to lose your hair at 30 for the man, and for the woman it's around 40. The fertility of a male and female will start to go down from 30. And by 35 is very much evidence. You're losing hormones by 1% every year after 40. And after 40, you're losing 10,000 neurons a day. So if someone were to say, I'm going to live to 120 years old, I probably would be smarter. I would not think it will be that way. You probably will be having more wisdom, wiser, but you're losing your memory because the frontal lobe will be shrinking. The whole brain is shrinking. The whole brain with 52 lobes, that means parts, and 67 different types of brain cells performing different functions are all deteriorating. Your brain starts to age at 20. 66 of the cells aged at 20. But there was one part of the brain which was very special, and it is very important for all of us, is our memory and our focusing power. That is the frontal lobe, and it only will be fully developed by the age of 25 to 26. So if someone would have asked me, can you make someone more intelligent, smarter? My answer will always be yes. You have to give the frontal lobe. So again with us, can we maintain our brain to a higher extent instead of having a timeline of 60 to 70? My answer is still yes. My mom is 91 years old. My mother-in-law is 94 years old. My mom likes to pose on the camera. She still has a lipstick all the time. And that is quality life for her. She has never spent a single day in a hospital. Now, all of us will have a date with a hospital over time. But how many times you'll be going there, and the duration of spending the time in the hospital determines the quality of health in all of us. So I will always say, you must take care of yourself, and the best doctor in all of us here is you yourself and not your physician. Because your physician will never have all the time for you. A doctor has to see 30 to 50 patients a day. How much time he has for you? Is he going to remember everything about your supplements, your drug, your history? No, you can't. You don't expect him to do that. So it's high time for us to add into our cell span, extend the cell span, at the same time with the lifespan and the health span, by understanding more and educating yourself and create the awareness of education into yourself. And my job is to make everyone more educated. Throughout my life, I've been doing it for the last 38 years. I've been to 80 countries across the world, including South America. I've been to Africa. I've been to India. I try my best to learn and give, because I always believe to give is better than to take. You know? And the joy, what is the greatest joy of physician? It wasn't the money there. It was to turn a hope into reality. So when you treat untreatable disorder, you know, what is the best thing? To make the reality from the hope coming into the real. So when you say someone who have no choice, that means they have untreatable diseases, they are on their way to mortality. And if you can extend the quality life into them, and that is what we are doing now. So I spend my life involved in education very much. My first love is always education, because education means power. And with the power, it gives you the confidence in life. And this is how I learn about things. I am heading a lot of regenerative association of the world, being the non-European guy to head regenerative medicine, which stem cells is part of regenerative medicine. I learned for 3 over decades in biological medicine that comes from the Swiss and the Germans. I learned from the Soviets in the 80s on stem cells, and of course from the Germans and the Swiss too. So everything for me started at a young age, in mid-20s, at the age of 26, and with 38 years of experience over the time from 24 to now, I would say I have 38 years of experience. I'm 62 years old. My hair is still black. It's all real. I have never done anything on coloring on my hair. I still think I can still maintain a biological age and delay the increase of the biological age. My biological age is 48. So I like to do the same for as many people as possible. I like to add quality life to all of you. So from here, I'm going to explain a bit on the stem cells, the peptides, and the exosomes. Now, you already know what is stem cells now. So you have a certain amount of stem cells. Okay, and you know that now, by now, the stem cells will deteriorate in quality and quantity. It's not just a quantity, the quality is also coming down. So if someone were to say, I'm going to take some stem cells from your fat, or from your blood, or from the bone marrow of you, okay, I'm 62 and taking it from me. Or let's say I'm also a diabetic guy, type 2, you know, on insulin. What's the point of taking the cells and the stem cell of a sick person who is 62 and probably the biological age is even older? than 62. For most of us, a number of us, we have an older biological age than a chronological age. So you have to bear that in mind. Now moving from here, this is my background. I do a lot of formulations. I did a lot of research, and I've done 70 over publications published in UK and USA on stem cells and research, own a number of patents all over the world, and have written 40 over books. And there's so many things I've been doing all along, solely for education and research. But 10 years ago, we started to acquire hospitals and clinics. Today, our European Wellness Group owns 39 centers. In the PowerPoint, I showed 38, because there was one new acquisition. Now, everything was meant, given by God for us and leading us to do what we have. But what I have done today is, for all the profits of the company, starting with $2,500 in 1985, to a small mini empire of 1,000 over doctors, employees, and with a few hundred doctors, everything is given to science and research. We have never declared a single dividend in life. I only have a humble salary for myself and for my wife. And for that matters, we love what we do. Everything will be for research. And we do not make money treating children. That means they're paying at a very low price. And we do help a lot of children. I call them the children of the lesser God, where autism, cerebral palsy, Down syndrome, global delay development children are very highly prevalent in a lot of developing countries. Now, I've already explained a number of books I've written with a 70 over publication internationally, only published in UK and US, and was in the front cover. We don't pay money to have to be in front of any covers, and a number of them come from the Chinese government. For our technology, I have a stamp of my face in China for my contribution to China for biotechnology. My grandfather came from China, but I don't have the Chinese culture. I was totally English educated. So these are some of the pictures where we have done education all over the world. I've been to US more than 100 times, I think, over the last 3 decades. These are some of the clinics and hospitals we have, from Germany, Frankfurt with a hospital, to Santorini, to Athens Medical Center, to Lugano, and to Bangkok or Malaysia, or anywhere you name it. But we have nothing in USA. So what we have in mind now is to have something in US. And I think the first one in US will probably be in Naples with Her Holiness. Okay, and we are on the planning for all this to happen as soon as possible. We hope one day we can provide at a lower cost to all of you here and anyone else who come to us, because at this moment the costs are expensive. It's because it's coming from Europe. So someone have to fly over, the cost of freight is expensive. Again, the facilities, the clinicians, that means the experienced doctors have to be taken into account. The protocols, most of the time the diseases, treatments would not work is because the protocol or the diagnosis wasn't the best ones. So if you give the wrong stuff, how you expect it to work wonderfully well? It's quite impossible. Someone had a kidney problem, but you didn't give the kidney stem cells. You give the mesenchymal cells to do the stimulation, but it's not the right cells to treat the kidney. So to regenerate the kidney, you must have the kidney cells. To regenerate the heart, you must give the stem cells of the heart. And imagine you have 737 different types of stem cells and cells in your 78 organs. So if you have 700 over different types of cells and stem cells, why just consider only 1 or 2 types of stem cells for your body? So we have to look into specific to do this. And that requires certain experience and skills where we learn from everyone. And I use the word precision in medicine, which is so important. Precision is important, and I call them precision medicine, where you really have to throw at the dartboard. Even if you have to throw the 10 darts, all have to hit the bullseye. Then you see the good results. So this is how we go around, And I always believe that if you have to have the 10 darts, and you throw it and hit all over the place, The total accumulation would not be the 500 points. You need the 500 points, right to the point. So how do we know which dart to throw at, and what are the type of darts to throw into the different organs here? That can be easily found in your blood panel. Your lab work show a lot about your organs' health. The hormones test in your blood lab work. So from there, we can determine what is the health of your organ. Again, with technology, with the Europeans, we have certain devices to check on the biological health of your organ. To a certain extent, your biological health is the accumulations of all the health, the biological age of all your organs. So every organ is important. To revitalize the body, to repair the body, you must repair whatever organ that needs to be repaired. So when we talk about vitals, always in an emergency situation, the doctor's first answer will be, what is the condition of the vitals? The vitals means the brain, the heart, the liver, these are the vitals. But again, there are also many other organs which you have to take into account. Even the bones, your knees is coming down. You start to lose your bone mass towards 50. So bone, cartilage, everything is coming down. Every organ have to be taken into consideration. So we must have the blood test report, or we call them the pathological test. We must have a medical questionnaire filled by the physician, or the nurse, or the patient himself, or herself to tell us of their current situation, because we may not know the supplements or the drugs they are taking, and we do not know the history. It could be an asthmatic child in the past, or you have an accident with a surgery. So all these have to be taken into account. And that's how we assess from there. Now, I always say the law of similar here, but it wasn't me who promoted this in the first place. It was initiated in the 15th century by a Swiss physician called Paracelsus. And it so happened I was the owner of Paracelsus Clinic Luschmiller, the world's largest wellness hospital in Switzerland, in St. Gallen, many years ago. I own it and I sold it recently to the Chinese government. And I went on to put the money into other hospitals. And again, there was a Samuel Hahnemann who introduced the laws and introduced homeopathy. And they all still go with the principle of similibus curantur, like treats like. So it will be a liver for a liver, a heart for a heart, a kidney for a kidney. But we went a little bit more in advance here. When we talk about the liver, we are not going to give you just the liver. The liver is a filter. We all know that. Everything you go will go to the liver. Even the smell we inhale will have to go through the liver. Okay? So being a filter, it is also a dustbin. So all the cells will surface in the liver. That explains why in the liver itself we have 75 different types of cells and 75 different types of stem cells. So if you want to regenerate the liver is one of the wonderful, fantastic organs. We have the longest lifespan at 75. Your liver is only starting to age. So wonderful, isn't it? But of course, all of us also punish our body in some way. When you drink, when you have different lifestyle and you smoke, then you don't expect your liver to be age 25 then. It could be 55, okay? But the good part about us is that we went into the extremes. We are going to isolate the hepatocyte, which is the liver stem cells, from the liver itself. From the 75 cells, we will isolate the cells. In the same principle where we will do for diabetes type 1 and type 2. Type 1 diabetes is autoimmune, it's genetic, okay, it's autoimmune. But type 2 is a lifestyle. And one out of four of us after 40 could be a diabetic without us realizing it. So when you talk about diabetes, it's a pancreatic problem. Now, being a pancreatic problem, the pancreas itself has 13 different types of cells and stem cells. So how do you treat diabetic patient? Yes, I know there's many formulas and many supplements, Now, how do you get rid of the insulin? The right way to get rid of the insulin is to make sure you have the islet cells. The islet cells in the pancreas will be the alpha, beta, delta, and the exocrine pancreas. I try to be less technical as possible. I know most of you are not medical doctors, but I'll try to make it simple for everyone to understand. If you were to give the islet cells for a diabetic patient, it will repair the pancreas. That is the right way to treat the cells. So you can think of any supplements in the world. You can think of all the supplements, the herbal supplements, whatever, but the right one, and if you ask me personally, my father died of diabetes type 2 at the age of 57, so I dedicate my life and research on diabetes. We did 4 books on diabetes. We have a peer-reviewed journal done in UK on diabetes. So I would sincerely think diabetic patients, the end game is that it will affect all the other organs with a complication. The end game of a diabetic patient is a kidney transplant. So we have to take care of the kidney because the age of the kidney is 50 years old. The lifespan of a kidney is 50 years old to 55 years old. So obviously you must take care of your kidney because if you ask any any doctors of the world, they say, oh, the heart and the kidney is not regenerative. You're born with fixed kidney cells. You have the best kidney cells when you're born, and it starts to go down as you age. But going down, just like aging, just like disease, progression of disease, they don't go down like this. They always go down like this, acutely down. Just like aging. It goes down never like this, it's like this. So our job is to do the repair, do the treatment, and push it up, and then it go constant. But after some time, it will still come down again. So you keep on pulling. So it's like you are in the fishing game, or when you're driving a Lamborghini or Ferrari, you're accelerating. Now, when you keep accelerating, you're burning the engine. There's a risk of an accident. What happens when you press the brake and re-accelerate? You change the momentum of speed. And that is what we are doing. We are changing the momentum in your aging process. You age faster. If you are in 60, I come to realize for myself, I was telling Her Holiness Sai Maa yesterday, for the last 3 years, at 62, I come to realize I age faster than I was before. Then what about when you're in your 70? What about when you're 80? You age much faster. Remember, when you're in your 20s, you may not sleep for 3 days, you're still good. But these days, without a sleep for a day, some of you may not last at all. You will say, I have a headache, I have this, I have body ache, everything is coming in. Okay, so this is aging. So is there a way to delay aging, extend longevity? Of course there is a way. Look at the organs' health and do the repair. To do the repair, you must give the right cells, all the stem cells, all the peptides, all the exosomes. Now, I think a lot of things is coming in. Now, I'm not a doctor. I'm very confused. What is a stem cell? Cells now I know. But what about exosomes? What about peptides? A peptide is a short-chain amino acid, a component of the cells or the stem cells. It can also be artificial peptides. Of course, the organic one will be better than the artificial one because artificials are chemicals. Okay. Now, this is a general understanding for you. And what is exosomes? Now, everyone is talking so much in US about exosomes. When we introduced exosomes in the world, it was 2011 in A4M, Las Vegas. We introduced exosome, and that was so far, and that was 11 years ahead. And 3 years ago, US started to introduce exosomes and say it's cell-free. Now, if someone would have asked me technically, is the exosome, which are the secretions and waste materials of a cell, a living cell or a stem cell, work better than the cells or the stem cells? I always honestly will tell you it won't. Of course, the best cells for you will always be the stem cells. Again, the stem cells are many types, so you have to understand which type. So the stem cell is always on top, followed by the cells, followed by the peptides and the exosomes. This is how, through my experience of dealing with the cells. So again, you understand, you have 12 systems in your body, they have 78 organs, and what is inside the 78 organs? You understand that you're aging. All the organs are shrinking. Every organ shrink. When they shrink means the function also drop. But there was one organ, the heart, which enlarged, which wasn't good for you. And for the male, you have the prostate which enlarged. That will also take away the quality life. Every male after 50 have a risk of enlargement of the prostate. Can we delay the progression of the enlargement? The answer is yes. We can delay every organ's age. Do a reversal of the organ age by 8 to 10 years. This you can do it with the best with the stem cells, the right stem cells of the organs, and or the cells, or the peptides. But of course, the stem cell will be the best. Okay, and from here, you come to understand today, in the human body, it's 737 cells. And let me tell you, some physician may not even be able to tell you how many cells there are in the body today. Because with new findings, with new publication, we come to realize that more things out every day, you know. So life is a learning process. If sometimes some doctors would tell me, I don't need to learn more about stem cells or medicine. I learn everything about medicine. I'm master of everything. I honestly would say, no. Life is a learning process. Every day there's some new stuff on nutrition. Every day there are new stuff on organs. Every day there's new on technology. Just like you have an iPhone. In the old days it's iPhone, then 2, 3, and today it's 14. But in the next few months it'll be 15, 16, and 17. It goes on. So we must learn until the day we die. So are we going to say that you can't retire? Yes, you can't. You shouldn't retire at all. Because when you retire, your brain is not exercising, then you will deteriorate faster. But of course, over age, you work lesser. Okay? You must work, but you work lesser, that's all. Your brain must be exercising all the time. Okay? So I explained on the 12 body organs. Now, of course, each organs, they have different functions. We all know about that, okay? And this is something you understand better today with the 78 organs. Now, I also talk about the brain, 67 cells, and each perform different functions. So if you have someone, an Alzheimer's patient, a Parkinson patient, a cerebral palsy child, an autistic child, they will be given different types of brain cells. It won't be the same type of brain cells, obviously. Now, what about all of us? I was telling you that you are deteriorating with losing 10,000 neurons a day after 40. That's scary. That means I'm going down. My memory is going down. My focusing power is going down. It looks like I can't remember what I have. You know, I keep forgetting things now. Can I improve on that? Yes. Give the stem cells of the brain, the frontal lobe. Okay. Again, someone is telling you that, oh, I can't sleep well. I have insomnia problem. That's part of aging. So to make you sleep well, you need a release of melatonin. Biologically, 8 to 10 o'clock is the release hour at night for the melatonin. And melatonin comes from the pineal gland. So you have to fine-tune the pineal gland to release the melatonin. So again, with hormonal changes, every one of us, I was saying that you lose your hormones 1 to 2% after 40. So what happened to the woman? She's moving towards menopause. When you have a menopause, she will age 30% faster. 30% is a huge amount. Everything is going down, you know. What about the men? Yeah, they also have their menopause. We call them andropause. But they seem to go fast, less, faster. That means they can delay longer, okay? So again, we have to fine-tune the hormones. So we must balance up the hormones. So from the hormonal test, with the endocrinologist to look into it, we can fine-tune the hormones. Now again, we all know, with menopause coming in, or the man losing the muscles, okay, they will go for HRT, some of us. Now, I sincerely would not encourage HRT because I always believe in the holistic and biological way to treat the patient. So I would say, don't go for HRT first because there's a risk with HRT. No doctors in the world can tell how much enough and what type of hormones is enough for you. So if you can fine-tune the pituitary gland to release the hormones, you know, and instruct the adrenal cortex, which is releasing your sexual hormones. When you lose your sexual hormones, you are aging. When you think lesser in sex as you age, you are aging, okay? Now, the adrenal cortex will send a message down to the gonads, that means the ovary of the testes, and you add the liver to metabolize it. This is one of our formulas. It will work very well to release the male hormones or the female hormones. This is the way to do it. And HRT will be the last resort when nothing works out. So that is the holistic way to treat, which we learned from the Swiss and the Germans. Now, I also explained on the pancreas, I explained on the liver. So there's so many things, and this is a chart to tell you, look at the chart. The figures can be scary. You're seeing the lungs aging at 20, brain going at 20, skin going at mid-20s, muscle losing at 30. And what happened to the man when he loses the muscle? That means he's having lesser testosterone too. You know? So what happened when you have lesser testosterone? The aggressiveness of the man is gone. So the man will become more feminine as he ages. And what happened to the woman? She has there's a proportion of testosterone in her, you know, and there's a lot of female hormones. As she ages, the female hormones drop down. She will be more manly. She will have more hair as she ages, compared to the man who ages, he do not have hair as he ages, you know. So these are some of the things which I'm showing you, you know, and with the timeline, you have to really take care of your health. And you look at the figures around you here. Now it looks like they're 40, 50, 60. And you are talking about living to 120 in USA. You know, everyone is talking about we will live until 120. All the doctors in the field of aging, anti-aging or whatever you name it, or reversal of aging will say we will live to 120. Is it possible then? It's not easy. It's possible. Because the oldest woman who died recently 2 months ago is a Japanese. She lived to 118. But many years ago, there was a French woman who also died 118. Now, with technology, of course, we can extend life. Okay? We only have to do the reversal of the organs, but you have to do it all the time. You cannot be doing it one time and finish up and say, I repair the organs, because it starts to age again. So that means to say you may have to see your physicians or the right people for stem cells or cells, regenerations, every 1 to 2 years, if you want to maintain the best. Again, it doesn't mean you have to spend a lot of money sometimes. Sometimes you may not need the stem cells to regenerate that well. If someone were to tell me I have a fetal liver, I would say you don't need the stem cells to do a fetal liver of the liver. Okay, you don't need the stem cells of the liver. Even some other peptides of the liver may bring down the fatty liver. So there's a lot of solutions, and a lot of things may not be as expensive as you thought. I know in America, prices are higher. Prices for equipment, everything is higher in USA. But there are solutions in a lot of ways. So to extend the life, we have to extend the lifespan of the organ. The lifespan of the organ. We have to expand them. To expand the lifespan of the aging organ, obviously when you look at the aging organ which is shrinking, what is happening? The cells in the organs are shrinking, are dysfunctioning. They have lesser function, they will not be as active as possible. What are you going to do here? You have to do a stimulation of the aging cells. But you also have to do a replacement. You have to add some younger cells into the aging cells. Even if you have to look at the law of average, if 70 plus 3, what will it become? You divide by 2, it will be lesser. You see? So that is the way we have to go with the game. We have to replace and we have to stimulate. Again, replacement means you have to replace the right organ cells. So this is where we have to come in. Now these are the vitals, you have to do that. Again, for example, the heart. The age of the heart of a 70-year-old will be half the function of a 30-year-old. So if you are approaching 70, don't expect you to have a lot of stamina because you have a poorer heart. So can you increase the stamina of every one of us, including sportsmen? I work for the National Sport Council of China. So they lost the Olympic to the American on the last day in Japan recently. You know, they were very upset. They do a lot of postmortem. I received a lot of phone calls, and they asked me, how do we win the Olympic in 3 years in France from now? What should we do? I say, all you need is the stamina and the endurance. You must have the stamina in the field. It's like the World Cup football now. It's playing around with the footballers. They're spending a lot of time on the field. You will realize by the end of the second half and extra time, they don't have so much stamina to run, to last the distance. So you want to have the stamina. You must give the heart stem cells of the peptides, and again, you must have a bigger lung capacity to have the oxygen pumping in and out. So you need the lungs, you need the heart for endurance and stamina. Again, for a sportsman, you have a lot of anxiety. You may be the best sportsman on that day, but you didn't have the good. You have fear and anxiety with you. You may lose the match. You may not be the best person. The best person sometimes don't win the match. So again, everything is on the mental side of all of us. So you also need the brain stem cells, or the stem cells of the brain. And this is how we go with the sportsmen. Of course, along with the sportsmen, they need muscles. Can you build muscles? I'm saying you're losing at the age of 30. Yes, give the peripheral muscle. You will have the muscles. You can, because we treat a lot of patients who's lying on the bed. Now, when you lie on the bed for too long, you're losing muscles. So muscles is another part of us we have to take into account. All of us are losing muscles, okay? Now, I also show around here the number of stem cells you have. I did explain you're born with 1 over 10,000, but look at the chart as it goes around. Even by the age of 30, it's only 1 over 180. So you are losing a lot here. Now, this is another chart I did, Look at the angle going down. It's acutely down. The world is acutely down. So imagine at the age of 18, you only have 40% to 45% of your stem cell in your body. And we are still in college or university, And imagine the age of 30, you only have 25% left. So it wasn't easy all the time to last the mile. It wasn't easy. But it can be done by understanding our body and treating our body and do the reversal. You can reverse aging by reversing the organ age, not by 25 years or 20 years, but by 8 to 10 years biologically. You can do that. So you must reverse the aging cells in your body, make them younger, okay? And of course, then you have to do the delay in the progression of aging. We all can't stop aging at all, but we can delay the progression of aging. So when you look around your friends, every year I will meet up in the alumni, I meet my colleagues, we are classmates or schoolmates, maybe 40 years ago, but every year I see someone missing. That means they are gone. They're no longer around. And again, I see someone who is much younger than me, and I also see someone who is much older than me. So at the end of the day, it's your lifestyle, your education in you, how you have to take care of yourself. Everyone has stress. And I always say cancer is a disease of stress because the stress causes the hormonal changes in the cells. So when the cells start to reactivate abnormally, it becomes cancer cells. And cancer cells will always increase as you age because the thymus gland, which is born bigger than your heart as a baby, producing the T cells, or we call them the immune cells, will no longer be around by the age of 65. That's why mortality set in, is because you don't have enough stem cells anymore, and at the same time, you don't have a strong immune system. You're prone to infection. So with the COVID, you come to realize the FDA of all the countries will start to inject on the senior first. But we also come to realize the FDA of some country ignore the seniors because they come to realize it's difficult to save them. They're going to spend a lot of money saving them. So they rather spend the money on the younger one and save the life of the younger ones too, in some country, I have to say that. Again, with COVID, there is no discriminations of the rich or the poor. It can affect any one of us. So I spent my life traveling even during COVID. I've been traveling so much, even during COVID, where even in 10 days of travel, you will be with something on your nose or on your throat even more than 10 times. Because you leave a country, you have to do it, a PRP, a swab, a PCR, and then when you arrive, you have to do, and you leave the country, you have to do, you arrive in another country, you have to do, and you're quarantined all the time. I have yet to be infected, touch wood, yet to be infected. We have been involved in conferences, we've been talking a lot. So I tell myself, in order not to be infected, also to the doctors and the patient, you must have a very strong immune system. Just like a woman who gives birth, the first 6 months she has the best immune system, and also the baby. If anyone were to cough beside them or are sick or were to to infect them, they will never be infected. Because during pregnancy, she accumulated a lot of nutrients, and the placenta was giving the life to the baby. Without the placenta, there is no life. So the enrichment of the placenta were all there. So when I first introduced placenta in 1985 to the world, made in Switzerland, supplements of placenta, it was selling very well throughout the world. But again, we also have to understand the function of the placenta. It's a wonderful wound healer. It's a good hormonal balancing ingredient where every woman would need them after pregnancy or delivery. But again, if someone have a very high cancer marker, we can't use the placenta because it's stimulating. Anything which stimulates is not advisable to be treated. So when someone were to tell me, is it good to use the stem cell to treat cancer patient? I would say you have to be very careful. You can't use the endocrinological cells. That means any cells which produce hormones, you can't use them. You can probably use the thymus. And you can't even use the mesenchymal cells, which are the tissue cells or the multipotent cells to treat cancer. But I see a lot of physicians are doing that throughout. So that is my experience learning and learning from the rest. Now, this is something I contributed to Cambridge this year, a chapter. The whole world was talking about totipotent cells, pluripotent cells, multipotent cells, and nothing much about unipotent cells. But you only have to understand a bit of them. You can snap a picture here. I know you can have a PowerPoint or all this. We need you to understand for your own good knowledge. The whole world is also telling the world that stem cells will differentiate into all kinds of cells and become dead cells, and they will work for you. No. The answer is no, it's not true. Only certain type of stem cells can differentiate. Embryonic stem cells will differentiate into all types of stem cells, and they are not encouraged because they act like cancer cells then. We don't want our cells to be into a cancer cell. Of course, you have the multipotent cells, which are the tissue cells. Now, the word is tissue, and the word multipotent means there are 8 or multipotent cells in the chart here. I put it very clearly for everyone. So when you take the umbilical cord of a child, which most of us are doing it for the stem cells treatments, you will have the hematopoietic cells for blood disorder, to thalassemia and leukemia will be good for that. And it will be good to have for tissue repair. Mesenchymal cells is good for the knees, but the answer is sometimes it works and sometimes it don't work too. Because mesenchymal cells some of the cells will turn into mesenchymal cells, or the mesenchymal cell will turn into cartilage, but some of them do not turn into cartilage. So you will find a physician who treat 10 patients, all with a knee problem, but not everyone will have the best knee repair. Some of them don't even see the results. So what is the best way to do this then? If someone were to tell me, I would say, I will use the mesenchymal cells, hoping that it will turn, but I will go into precision now. I will give the cartilage with the synovium. Because as we age, we don't have the synovium, then we have a joint problem, we have a knee problem. We all will have this because there's a timeline for us using our knees, and of course weight play a lot of factors with the weight. Now, I also show on number 4 there, on your right bottom, the unipotent stem cells, which is widely known in Europe and not widely shown in USA. It's not widely introduced in USA. These are what we call precursor cells or progenitor cells. If you do your research on progenitor cells, you'll find there's a lot in PubMed. Here we are talking about specific organ cells or stem cells. And this is important. To repair the lung, I will always give you the lung cells. To repair the skin, if you want to have the most beautiful skin, of course, it's better to give the skin, the stem cells of the skin than anything else. So we go into very specific here. You must be specific. So we are talking about 730 types of cells here. The 8 will be the tissue cells, which will be the multipotent cells. The 729 will be the organ cells. So you have a lot to play with. So when we treat people with RP, retina pigmentosa, there's no treatment in the world for this. You ask any conventional doctor, they say, sorry, there's no cure for retina pigmentosa, you know. Now, our experience tells us that in Europe, we have been doing it by giving the retina cells, the optic nerve, and the occipital lobe, because the eye needs to send a message to the brain. Your eye can see, but the brain can't see. So at the end of the day, you don't see, although the eye is seeing. So these are something where everything depends on the brain. So you must have a young brain. You are as young and as old as your brain today. So please take good care of your brain. Of course, some good supplementation help, but at the end of the day, what will be the best thing for your brain? A brain for a brain. That will be the best thing for your brain. So the brain stems will be the best. Okay? So that is how we go with this. Now, there is a myth that stem cells will regenerate and turn into all types of cells. I already explained. My answer is that stem cells will only turn into all types of cells when they are in the pluripotent stage, the embryonic stem cell, which you also have a risk of turning into cancer cells. We don't want to play with this type of cells. We will not encourage the treatment of embryonic cells. Okay. Again, stem cells will not turn into all cells when they are in the precursor unipotent stage. Now, what do you mean by that? Now, when we talk about unipotent cells, okay, or precursor cells, which are unipotent or progenitor cells in another name, these are undifferentiated cells in the final stage of differentiation. So that means they are going through cells after organogenesis, the formations of the organs. You took those cells. These are undifferentiated cells in the final stage of differentiation. They are the fetal cells. So what is the best cells for the world, for all of us? Fetal cells, because there's zero age. Because if you were to take it from the adult, we call them the adult cells. If you take it from another person, we call it allogenic cells. And if you take from ourselves, it's autologous. They are as old as a cell, like I already explained. Again, from the adult, what do you have from the adult? You cannot kill a man for the brain. You cannot kill him for the liver or heart or kidney. So you can't do that. So what is the market is doing with this? They can only take the tissue cells and say these are stem cells. They will do for everything in regeneration. No, they will do the stimulation. They may not do the regeneration. They will only do the regeneration of the tissues and not the organs. So this is some education we also have to clear up even to physicians. Because even physicians are not very clear on stem cells. They are not an expert in stem cells. They are treating patients. But who are producing the stem cells? The lab are the people who produce the stem cells. So we also have to understand the mechanism of the stem cell to a certain extent. So when coming back to this, in the case of mesenchymal cells, it will only turn into tissue cells and never organ cells. So that explains the reason why a lot of patients who are treated with mesenchymal cells will not see much good results when they have an organ problem. You can include that. So what is the solution? I was telling the doctor, you can use the human mesenchymal cells or the animal mesenchymal cells, but you still need the organ cells where you have to take it from the animal. It can be a sheep, a rabbit, or whatever. But you have to take them, but you have to take them from safe sources, and they have to be with FDA-approved sources. And Charles River in USA is the world's largest supplier of SPF animal. What is SPF animal? Specific pathogen free. And in Europe, we call them VAF, virus antigen free. They are the best source of animals, best source of organ cells, and you can take, they're free from pathogens. That is important. Now, again, someone would say, why must I take animal? We are man, but we already forgot that man is actually an animal himself. We are the most intelligent animal. So why do we need to take the fetal stage? Because in the fetal stage, Cells, all the 737 types of stem cells and cells from the 78 organs, from all animals, including man, sitting on top of the animal kingdom, that they are alike. There is no rejections, there is no immunoresponse. That explains why you have to take from the fetal stage. Now, what about the antigenicity? There is no antigenicity or low antigenicity in the fetal stage. Antigenicity only set in when the baby is out from the mother. When the baby is out from the mother, the baby will suck the milk of the mother. This is where virus and bacteria enter the system of the organs. So when you take from an organ in the fetal stage, when it's totally clean and it's not functional yet in the sense that it's not been filled up with virus or bacteria, that is the best organ. So I always say that is the 0H. So that will be the best cells. And again, rules in different countries are different. In Europe, in Switzerland, you can't do autologous stem cells. That means from your own body. You can't take the stem cells from the body and re-inject it back in Switzerland. But they allow animal cells therapy. They've been doing that for the last 200 years. So rules are different here. So you have to look into different countries when you have to treat patients who have untreatable disorder or who need to be treated. So again, some countries are getting more open. Okay, the Caribbean side are more open. So some of the US centers move up to the Caribbean or to Panama or to Bahamas or some other places. But Japan is also one of the great countries where Americans look highly upon in stem cell research with a few Nobel Prize winners, and they are more open. Asian side is more open. Greece is more open. So there are some options where if you can't do it in America, probably you have to do it in some other places. That's the only solution. So I have a lot of Americans who come to Asia too. You know, apart from going to Germany, Switzerland, or Greece, they come to Asia too. It's because there's no other solution. So you have to go to some place. No one wants to die, and it's painful to die too. So quality life means you should be dying in your sleep happily after a meal, okay, and not suffer in pain. I always say that. So I always would see if someone is walking with a stick and suffering in pain to walk up and down, that is not quality life at all. We do not want that, okay? Again, to regenerate the organs, we need an organ for organ. I always say that. Why? Why regeneration can only take place with the same organ? Because only the same organ, a liver for liver, a heart for heart, will have the same molecules. You can't regenerate if you don't have the same molecules. Again, to regenerate, to facilitate the regeneration of our organs, you need sleep. You can only regenerate during your sleep. So if you don't sleep, you don't have enough sleep, you don't regenerate at all. So everyone is asking me, Mike, you're sleeping 4 hours a day for the last 30 over years. Then how do you regenerate? You're an advocate of that, you have to sleep to regenerate to all the patients. Now, I do sleep in a hyperbaric cabin. Okay, every day for 1 hour, because I have one at home. I will sleep into it every day. So my 1 hour is actually equal to 3 hours of a normal sleep. So that explains why I do not have to sleep so much, and that is one of the ways. Now, we also have to understand your body, because everyone has a different mechanism. So if someone were to tell me you can't eat and before you sleep you shouldn't be eating, it depends on your lifestyle. It depends on your body. You have to understand your body. And you have to learn up how to understand your body. This is another chart which will also be good for you to snap up a photo and understand yourself. Because even the doctors are getting confused. Which type of stem cell should I be giving? And you yourself as a patient putting a lot of trust on your physician, you will be wondering, what type of cell should I be giving then? Should I be having? A lot of you are paying a lot of money, but sometimes you may not have the results you're paying for. So it's high time to understand yourself, what are the right cells to be given. Your cells is important, okay? Now, again, it's not just the animal cells which I specialize in. I do start with the human stem cells with the Soviets in 1985. The Institute of Biological Medicine started stem cell research. It was the Soviets who started stem cell research, not America, first in stem cells. So when they started, they were using aborted human fetuses. And being a very staunch Buddhist, I would not accept that. But I was learning under master, so I can only learn and observe. And when I turned into a Roman Catholic because of my wife, who is a staunch Roman Catholic, I also have to understand Roman Catholic is against abortion too, okay? So for that reasons, I have certain reservation of using human stem cells in the sense you only have the tissue cells, you don't have the organ cells. But again, in our daily practice, you're faced with different decisions of different patients with different requirements. Some patients will say, I don't want the animal, I only want the human. Some patients will say, I don't care as long as you save my life. You know, some patients say, I'm vegan. Sorry, I can't take the animal, neither can I take the human. So you have different situation here. So in my honest opinions, I do the animal, I do the human, I also do a lot of times with the plant. I love greens all my life. So I love the plant. And I have a plant in every room and corner in my house. Every toilet is with a plant because I need the oxygen during photosynthesis to release the oxygen and absorb the carbon dioxide in the room. So if you're living in a land with a lot of forests or trees, you are having the best negative ions and you live longer. So the people in the lab actually live longer because they have the cleanest air too, okay? So with this, I introduced the autologous, I call it the A cells, which are allogenic and autologous. These are human cells. This, in the case of someone who asks me, Mike, I don't want the animal, I have to leave the human, then this is what I will introduce. I do that too, just like what you have in America. All of them are doing the human stem cells here. But again, it's limited. I already said there's only 2 types of cells here. So you don't have all the types of cells. Again, when you come to exosomes, a lot of us are talking about exosomes. You know, it became very magical in USA, and it spread to other parts of the world. So when we introduced exosome 11 years ago, no one really took very good notice of it. Okay, we are the first people who produce exosomes for the world, apart from placenta, and probably the first people who introduced stem cells to Asia. That includes China, Japan, Australia, and the Middle East, because it was a very early stage. So again, with the exosome, what we have in most part of the world is only 1 or 2 types. So I come with a situation where I can give the human the 2 type, but I also give the animal with the 700 over type. So that is the difference. You're going to specific to trick, and it is important. I mean, common sense in all of us will tell you, if I have a liver problem, obviously I think the liver is better than to take the eye or the heart. Common sense. So we have to go into that. We have to be pragmatic in our approach. So with the exosomes, there are some benefits. I will not say they are not there won't be anymore. They don't have enough benefits. They are, but again, there are limitations. So it depends on the situation. Now again, moving back to the animal cells, we call them the PSC or precursor cells. A lot of people is asking, Mike, how many cells are you giving to the patient? You know, we give a concoction of 14 to 16 different types of cells, stem cells. So we don't give you only one type. We give you 14 to 16 according to the condition of your organs, your health organs. The health of your organs we will give. Now again, giving more doesn't mean it's the best. If you don't need it, you shouldn't be taking it. So again, when Americans are taking 100 pills a day, I will always say, why must you take so many pills? Are you going to think that all the pills will do some function on your organs, but you forgot that your liver had to do the filtering, and it's taxing the liver, and it passes the function to the kidney, and the kidney have a lifespan, so you're also endangering the lifespan of your kidney. So you only take the supplements you need, and you shouldn't be taking all the supplements in the world. So we have to look at your health and determine what type of supplements you should be taking. The same things go for all the drugs. There is never a supplement or a drug or a therapy which is a one for all. There's nothing a one for all. If someone say, take this, it's good for diabetes, good for anti-aging, good for everything. No, there's no such thing in life. So there must be a modality of supplements, therapies, and treatments. It's the same in the treatment of cancer. We have a cancer hospital in Germany. It's called the German Medical Center. All the patients are cancer patients. But we will never do chemo or radio first. We have a holistic way of treating the cancer patient. And if someone would have asked me, how do you treat cancer patients in Germany or Switzerland? Now, the German and Swiss has their holistic way, and they call it biological medicine. So I wrote a book on biological medicine, encompassing and putting all my 30 over years of experience in biological medicine into the book, and it was out into the market, and it's selling quite well. It comes in 7 languages together with the stem cells. And it so turned out Deepak Chopra, when I know of his name, he don't know me, he bought the book on the internet and said it's a must-have book. So when he put that on the internet, obviously the sale went up too. Many people start to buy the book. Okay. Now I did it for education. None of the books were meant to be sold for money. So a lot of books are meant for education, to support back the education part of it. So coming back to the cells, if someone would say, I take your stem cells from your fat, or from your bone marrow, or from the umbilical cord of a baby, given birth, or I take from your cells and expand the number of cells, from 2 million to 200 million. Again, I have to insist, these are quality. The quality is the same. So it's no point to have a big amount of quantity. Please remember that. The most important thing is the quality of the cells. So that moves you to think, what about if I take it from my grandson? She's younger. Yes. But what do you find from the grandson cells? They have younger cells, good quality cells. But there's another problem. There's only tissue cells there. So we want to treat, we need the organ cells. So again, there are certain limitations in all of this. So that explains why animal had to come in for that. Okay. Now, normally they will give you, they count and charge you by the wires. It could be 50 million or 100 million or 200 million. And here we are talking about giving you 1.2 to 1.5 billion of cells. Is more than enough for what you want. Okay, and they're different cells. So they work and target different organs. And this has been proven by a Nobel Prize winner that cells have signaling, and by Professor Gruber-Gantel, is a German-American, in 1999. But 90 years ago, there was another doctor who proved the homing effect that cells have signaling, and that was 90 years ago. And he is Dr. Halsted. So we learn from all this. We learn and we analyze, and we move and repolish whatever we are learning. So there are therapies with the stem cells. We call them the main therapy, but they are also supportive therapies. So the supportive will be, you did the stem cells, you don't expect the stem cells during a 1 or 2 days or 3 days treatment. It will do the magic and complete all the therapies, solve all your problems. It don't work that way. Regenerations take months. And I always say 3 months is the best. So you do a comparative of your blood panel, lab work, after 3 months. That is the best way. So if some doctors or anyone promoters will tell you, take the stem cell, it work very well for you, it will work. Now, we need proof then. So the only proof you have will be, have you done the publication of your products or your therapy to the world and accepted by peer-reviewed journals? Or have you written any books to substantiate what you're promoting? We can't just sell something like a snake man oil. These days technology, all of us are getting smarter. Everything we will Google first. You probably will Google everything before you see the doctor and ask him a simple question and see how he answers you. Because we are all getting smarter, and we have accessibility of a phone where you can see all the information. So I will always say that with technology, everyone is getting smarter, but again, with technology, diseases are also going faster. Viruses are coming in a different way. We can't avoid the virus. They will continue to mutate. So we only have to make sure ourselves have a strong immune system. And again, every COVID-positive patients who have been treated and survived, they do have some organ damage. They will attack the lungs, they go to the lower part of the lungs, and then they go to the kidney, the heart, or even to the brain. So some of us will never be the same. I have a lot of patients who tell me, I don't feel the same like before. Even with the vaccine, some of us were saying that. So, I know the requirement that we all have to be vaccinated, but you'll be surprised there's a lot of doctors in the world who abstain from being vaccinated until today. So when I invite the Japanese doctors, I'm the head of regenerative medicine of Japan with thousands of doctors, to come to A4M in Bangkok. I'm also the chairman of A4M for Bangkok, American Academy of Anti-Aging Medicine in February. All the Japanese doctors say, sorry, we can't come. I say, why? Because we are not vaccinated. They are not vaccinated, they can't come. Can you imagine? So there's also a big group of people. So you have different opinions. You have to understand yourself, and probably sometimes you have to check with the right people to give their views or your own views, your investigation. So because of the COVID, we came up with some new formulations where we have been spending 40 years putting all this formulation and sold in Germany. Only in Germany. We own a biopharmaceutical manufacturing plant which only produce herbal remedies, homeopathics, and infusions from plant sources, or from myco, that means phyto and myco. And we come and we are forced to introduce this into the market to the world because people are getting more towards vegan. So we have to accommodate to the people there. Of course, certain plants do certain functions for different organs too. And we call them thermotherapy. And it has been existing for quite a number of years too, for 200 years it's been there. So we have them in sublingual form, where you put into the tongue, and again we have a technology where we won 3 years in a row in Switzerland for invention. And we also won it in Kuwait, Kuwait, a country in the Middle East, for invention by making the size of the molecules of the protein to become 2 nanometers. The skin pores or the mucosa of your tongue is 50 nanometers. Imagine 2 nanometers, that means you can penetrate through the mucosa. And when you go through the mucosa of your tongue, it's part of the digestive tract, it goes straight into the bloodstream. So we create an injectables and turn it into a sublingual application 17 years ago, and we make it for the organ peptides. And now we have them in the vegetal form too. Again, we also have it for the therapeutic side. There are stronger formulations. Of course, that require a doctor to do an infusion or injection. Okay. Again, I have questions about a lot of patients asking me, or even doctors. They say, if I give you a stem cell, which is the best route to inject on the stem cells? Do I inject into the organ if I have a heart problem, a liver problem? No, that would be too invasive. You don't have to do that. Again, would it be better with IV or IM then? IV means intravenous. Now, if you do a stem cells of intravenous, let me tell you, more than 90% will be trapped in the lungs. Trapped in the lungs. That means you're good for your lungs, good for COPD patients, but you will not be good for the other organs because they didn't go to the other organs at all. Okay? So the best way, through my own experience, is just do it deep intramuscular. Because there's a homing effect. It has been proven by isotopic studies in the 50s and 70s, half a century ago, that all the cells or the peptides will home towards the respective organs. They have their addresses within 48 to 72 hours. This has been proven many times. It's not even done by us. It's done by our peers in the past. Homing takes place within 48 to 72 hours. So all you have to do is inject into the deep intramuscular, even with the brain cells. So in the past, we have to do a lot of taking the CFS, cerebral spinal fluid, and then inject the brain stem cells to go to the brain. Then we come to realize we don't have to do that. So we came out and do some research, and it was found in chapter 3 and chapter 4 of my stem cell book, and also in a publication of the blood-brain barrier. The blood-brain barrier does open up to a certain extent over a certain period of time of the day. So this is where the cells will go through. And that is our experience, and it became a publication. So this is, again, another simple chart. Everyone is asking, they're getting confused. So I'm talking about our own stem cells without a biased situation here, without prejudice, I we produce all these type of cells as a manufacturers and the researchers. I give you a simple example by putting the ratings. Just like you rate a 6-star hotel and a 5-star hotel. It's the same here. They are ratings, okay? If you need a Lamborghini to drive faster to reach a distance, it's the same with the stem cells. Sometimes you need to save life, you have to go faster. Sometimes it's not to save the life, it's only to enhance the life of a patient. Then you probably drive a Toyota, is good enough. So again, it depends. So prices may be different. Again, if you meet the right people, you may not be paying a lot of extra prices, I would say that, okay? Now, of course, there's many drugs from animals too. I'm not pro-animals for that matters, but I would like to tell you, FDA or many countries have approved a lot of drugs from animals sources. Insulin is from pigs. It's been done for diabetic patients all along. Is there any rejection? No. What about heparin? It's also from a pig source. Heparin is used before and during surgery to prevent blood clotting. You're using it every day in a hospital. Is there any rejection? No. And what about you taking meat all the time? Is there any rejection? No. So I just want to tell you, as long as it's safe to be ingested, it will be safe to be injected too, okay? So we did a lot of studies on comparatives because we are always challenged, you know, so we have to be prepared for the challenge. And this, we have thousands of comparative histological graph or micrograph of animal and human in the fetal stage. And we show an example of this with rabbits or sheep, you know, in human, even with the liver or the brain or any parts of the organs. We have so many organs. We come to show that the structure is the same. The histological is the same. The cellular structure is the same. So that explains why I use the word in the fetal stage, cells of all the organs in all animals, including man sitting on top of the animal kingdom, the most intelligent animal is the same. So again, people will say, are you sure? Has there been a lot of study done in the country of the world? I will tell you, there are thousands of study done in different countries of the world. It will come after this PowerPoint. So Japan, being one of the top countries in stem cell research, they are the best, one of the top, because they also learn from the Soviets and the Germans, you know, including immunology. They learned from the Germans 35 years ago. And they themselves, as one of the top countries, the Ministry of Health, the FDA of Japan, moved 20 years ago into animal stem cells, quietly, because they couldn't treat diabetes type 1 and type 2 patients too. They don't have the islet cells from the mesenchymal cells, tissue cells. They need the organ cells. They have been doing that all the time. They approve pig stem cells because they don't have experience with sheep or rabbit. I do only sheep or rabbit. I don't do pigs. Because pigs have 6 prions, viruses, which can transfer to human. I do not want to have anything to do with human, so I only use pigs, I only use cow and rabbits and sheep. Now these are some examples. I just finished a book this week compiling all the publications of the world on xeno-based cells transplantation, and he came out in a book. He just released out today, you know. So even when you talk about US, there are 272 cases of studies being done or publication of animal to human. They have done a lot of publication there. It may not be that well known. Again, what about other countries? Advanced country like Germany or in other parts of the world, in Spain, there are so many. We have all the countries for that matters. Okay, so this is only an example to tell you that. And like I told you, research is very important. So all the profits from our company move towards research. We do have a foundation to help the children of the lesser God. I always call them lesser God because they are quite ignored in a way. And I told the NGOs, the organization, it's no point to fund them. You can fund them and take care of them, but you never increase the intellectual of them. You must increase the brains, give them the brain cells to increase the intellectual so that they can be on their own and not be a burden to society. So if you can do it for Down syndrome, obviously you can do it for other brain disorder. You know, we've been treating thousands and thousands of Down syndrome. Now coming back to Heidelberg, Heidelberg is one of the top 15th century existing since then in stem cell research. and they have been very world famous for stem cell research or cell therapy in the old days, even 30, 40 years ago. And I told you Japanese learned from them and the Chinese too. And we have been funding Heidelberg University all the time because my mentor comes from Heidelberg University. I was just back from Heidelberg University recently, a few weeks ago. We continue to fund multi-million dollars, euro into this, And we also did a multi-million US dollars funding by the European Wellness Group with a company called BioPep, which is owned by us, in USA, where we are moving towards FDA filing. There's a lot of things which is going on because no matter how difficult is the path we are facing, because we are also under the scrutiny of a lot of industry here. Some people don't like stem cell research because stem cell research is not big money for some countries. For the pharma industry, it's not it won't bring the money because you can't standardize with biologicals. You can't patent stem cells to a certain extent, okay? For that reason, you will understand why pharma never went into stem cells, okay? So there's a lot of things going on, and I always use the best materials, whether it's the human or the animal. So even in the human stem cells, you have to understand, you are given the stem cells, the physician are given. The physician themselves do not know where the source is coming from. So do you know the history of the donor? You don't know. So it can be a history of a donor with a series of genetic problems, and you're given the stem cells, and you took it without realizing it. So the source is important. It's high time to ask a certificate of analysis, a certificate from the source. Which cells are you giving me? From where? Because everyone just give you the source without giving you the stem cell without telling you the source or where they are really produced in. So all these are important. These are all FDA papers, and I use the FDA papers because I do not want to be questioned by other countries. Are you FDA approved? We only use FDA approved animals here. So that will be the safest part. Now moving into specific here, this is autism. We have treated thousands and thousands of children with autism. We have written 3 books in UK on autism, done a peer-reviewed journal in UK on autism. And there are so many autistic child today, even in US. In China, we work with the Chinese government, there are 30 million autistic child in China alone. In US, the rate is around 1:39 now. 10 years ago, it's 1/600. Today, it's 1/39. So it's a big amount here. Okay, and it's not easy to treat autistic children. There are different spectrum too. But through our experience, we have done a 28-year-old lady. We have done a 24-year-old American boy who came down a few months ago, and we put them all under control and under good results. So how do you ensure they have improvements? It was a disorder with the brain. So obviously, you must give the brain cells. You can give the hyperbaric treatments, which is good for the brain or for all of us too, because you need the oxygen for the cells and the brain cells. But again, there was an impairment with the parts of the brain. So from this chart itself, you notice on the right top bottom, on the bottom side of this, on the right-hand side, there's a number of brain cells we gave as a guide for autistic children. So we can know from which part the child is having a problem. Why? Because from the pediatric report, you know that. For a medical question you fill out, we can assess. From the observation of the behavior of a person, you know the character. So there's a lot of things here we can understand. So again, with the Down syndrome, no one wants to treat Down syndrome children because no one is interested for these children. And imagine you've been treating Down syndrome children at 19 years old. It's a very late age to treat. And we have been treating Down syndrome children as young as 6 weeks old. And we have Down syndrome children who went to university after that. So that is our experience. Now, Alzheimer's, dementia, this is another interesting part. It's a very big research going on among a lot of companies, and everyone is trying to produce some form of drugs to treat. But my solution will be check which part of the brain that is to be repaired. Just give the right brain cells. And we have been doing that for a lot of times. So that is my experience to treat dementia and Alzheimer's patients. And I told you every day, I'm telling you every day I'm taking a brain peptide. supplements from the brain, because I want to make sure my brain is still good when I'm 80 or 90. I do not want an extension of life with a poor brain. So the brain is important. All of you need the brain cells after 40, okay? Now, Parkinson, we have done a lot on Parkinson. If you go to our website, you will find a lot of Parkinson patients, live testimonials. They have done a lot of treatments with different types of stem cells. They don't see the good results because they never were given the brain stem cells. Parkinson patients need the dopamine. The dopamine releasing drugs have to provide the dopamine because the substantial nigra in the patient is gone. So we will want to take away the dopamine. We will cut down the dopamine by 70% within 9 months treatment. We reduce the dopamine by 70%. It's a huge withdrawal. We cannot give a sudden withdrawal for all drugs, for all kinds of disease, not even for diabetic patients. But if you can cut the reliance on the drug, you are actually extending the quality life of the patient. So that is our job, to extend the quality life. You have to give the substantial nigra. You have to give the frontal lobe too, because the memory is lost. So there's so many other different types of brain cells, you notice, we are giving it here. This is only a general guideline. Again, for diabetes type 2, you explain on the different chart. We give you an analysis of the different chart which is affected, and we explain on that. So patients can accept it reasonably well because you explain why and which organ is affected, and you're giving that particular organ. So we have a compendiums of chart, of 200 over charts, which we have done. We will publish it out for the doctors. The doctors like to use our stem cells because we have all the chart to give them a quick references. They can refer it and show to the patient. Again, stroke patients, I've been treating a lot of stroke patients. One of them was an American doctor, Dr. Michael McGuinness, who is a stroke patient. He had 8 stents on the heart, you know, and he was traveling in USA and he had a stroke. And he was rushed to ICU to save his heart, and both his kidney was also Kong off. So he was 8 months on dialysis. We treated him well. He's from Los Angeles, and he's 68. When I met him a few years ago, I told him, you look more like 88 than 68, because he can't even speak. He's on wheelchair, and it's so difficult to treat him. And the wife, Dr. Jurina, told me, my husband has done all the stem cells in the world. We will pay for any money you want. And I'm willing to do your stem cell, Mike. I tried all the stem cell in USA. I have paid the money, but I don't see. I'm disappointed. But since you're talking about the organ cells, okay, I like to try. And I don't have confidence to treat him either, because it was very late. He's already 8 months on dialysis. What do you expect for a person with 8 months on dialysis? And at the age of 16, we have done a 17-year-old American boy on dialysis. 17-year-old, we reversed the dialysis. We don't have dialysis anymore. But for Michael, it's a different ball game for us. It's a huge challenge where we dare not even take up the challenge. So I told Michael, why don't you try on the peptide first? You know, try on the stem cell peptides, the microorganelles of the kidney and the heart. And 4 months later, he called me and said, Mike, I don't understand what is happening. I'm very happy, but I'm also stunned and shocked. The doctors tell me I'm off dialysis, and my heart is regenerating. So that means to say the peptides of the heart and kidney is working for the heart and kidney. So I told him it's the right time for you to do the stem cell. I'm happy to do it for you. So he flew down to flew down to Germany, and we treat him in our Germany hospital. I have some scientists from MIT who came over and observed what we are doing at that time. And one of them is Dr. Ernov, the chief scientist for life extension at that time. So there's a lot of solution. I always believe there is a solution for everything. It's a matter of finding the right solution. And the protocol must be the right protocol. Then you will see the results. So again, with rheumatoid arthritis, it affects the organs, okay? And rheumatoid arthritis is autoimmune. Anything to do with autoimmune, you have to be extra careful. Stem cells may not be the best solution. The stem cells is only envisaged is to treat the affected organs. But to cure, to solve the autoimmune problem, in the conventional world, there is no cure. But we can put it under control. So if someone was to say, I have autoimmune, what is the best thing? Psoriasis, eczema, multiple sclerosis, where we wrote a book too on this. I would say all these are autoimmune. You may not just need you may not need to have the stem cells. We have to solve the immune system of your body now. So when you extract the serum of the patient, or from a cancer, the tumor blood, or the blood of a cancer patient, because cancer is also autoimmune. We have done 8 publications on cancer patient. The Buffy coat, which is formed on the 2nd to the 4th day, is actually the DNA of the immune system. So if you create a vaccine from this Buffy coat, which we do that in Germany, I learned it from my master, because my son is a chronic psoriasis patient. He has been treated by all the top dermatologists of the world, but I couldn't find a solution. But as a child, I learned from a movie starring Susan Sheraton, Lorenzo Oil. The parents went to all the extent to find a cure for the son, and they find a cure. So I did the same for my own son. He was the worst eczema psoriasis patient I've never seen in my life. And we managed to put him down. He was a Chinese boy, fair, and he looked darker than an Indian boy with the eczema, because he's scratching. It's all with the... Every day we have to change the bed sheet, and it's like snowing in the snow with the skin flake flying around in the air when you move the bed sheets. So it's a very difficult lifestyle, okay? It's not easy even to travel, because every 30 minutes you have to put on cream. So today he's a normal guy with good height, with good esteem, where in the past you have to cover everything up. So there are solutions, I always say that. So a lot of people is asking me about my hair, because every webinar I did, someone would text me and say, what products are you using for your hair? You know? So I was telling them I didn't use much product at all. But I did something. I'm losing 150 to 200 strands of hair a day. Even now, when I have a shower just now, I have to pick up the strand of hair and put it on the basin, because it's blocking the water and it's flooding the bathtub, you know? Now, if you are losing hair, it's common. As you age, you lose hair. The men's lose their hair at 30, the women's at 40 with the hormonal changes. But if you can still grow the hair, then it's not a worry part. What we are worried is you lose the hair and you don't grow the hair. So my part is to grow the hair. And it can be done so easily that it can be done in the clinic without any pain, without any blood, and you only need 5 minutes, 2 times or 3 times a week. So that is easy. No pain, no blood, nothing. Okay, you just use a very small cosmetic application where they have 22 micro needles where you can punch with the pressure and you don't even feel the pain, because they're so small, you can even put on the face. So that's what I did. I just give you a simple example of this guy. He's younger than me, he's only 50 years old. He's my phone supplier of 30 years. Each time he comes, he's losing hair. So I told him, Peter, just take this and do it yourself at home. So we do it once a week. That was not 3 times a week those days. And he grew the hair and he sent me this picture. It's all done by himself, okay? So there are many solutions we can do that. We don't need the drugs to do all this, because the drug will also have some side effects. You can grow the hair naturally. And of course, if I can grow the hair, I can also grow the eyebrow of a woman. Okay, I can grow the eyelash of a woman, and that is the same situation here. Now, what about people with gray hair? Can you turn all the gray hair back into black hair? No, I can't do that. Okay, that is impossible. But I can add more hair, which is black, into your gray hair, or your colored hair. Now, brown hair or red-headed people hair will have more strength of hair than a black hair. Black hair are the people with the lesser hair. They only have 90 million strands of hair. Compared to a red-headed person, it's 150 million. Brown hair is around 120 million. So you have brown hair, you have more hair than a black hair. Okay. So again, I've done a lot for animals because I'm an animal lover. I spend a lot of all my time saving stray dogs and cats in my country. I will save them if they are injured on the road. I pick them up, or even if they have died, knocked by a car, I will push the body at the side and dispose of the body, because I don't want the soul to lie on the street And when he's on the street, he'll be knocked down by the car, and the piece of meat will be all over the place. And I always say, as a staunch Buddhist in my early days, my next karma, if I do something wrong, I could be an animal too, So I save a lot. These are all actual pictures of dogs in USA. They are dogs in USA. And we treated the dogs. I work with breeders, and I do treat horses, and I did a lot of publication. We have done 8 publications on animals. They're all published in USA, and they're all done in USA. And of course, we also introduced the first book on stem cells on animals. So this is another part where we do a lot for the animals. We try to save as much as possible the endangered species. The cats in Africa, we are trying to do a lot for them there, And we enjoy what we're doing. We have a lot of testimonial. Go to the website of europeanwellness.eu. You will see a lot of websites. None of the websites are paid websites. We don't believe in paying money for testimonials. They have to come from the patient themselves at their own free will. If they're not willing to do anything, we don't ask for the testimony. It's up to them. But you do have some very, very happy people. So we have Parkinson patients here. You have women who have the menopause, and then we bring back the menses for them. We do a reversal. It's a reversal of aging, and there are so many other disorders, Parkinson's and Alzheimer's and all kinds of patients. Now, when it comes to revitalization, we call it male revitalization or female revitalization or regeneration. The word already tells you it's a word of reversing the age. Revitalize, regenerate. So what do you normally need? These are some of the things you probably need. The CNS is the brain, the whole brain, including the spinal cord, the adrenal cortex for your sexual hormones, the mesenchyme for your tissue, connective tissues, the placenta, the cartilage, ovia, the testes is important, These are the vitals organs you will need to have for most of us here. So even if you're a diabetic patient, you're an Alzheimer's patient, it's not just treating the disorder there. We also have to add all this in. So this is my simple example and guideline to the physicians. We treat a number of well-known Hollywood actresses and actors. We do a lot of sportsmen. They come to Germany to be treated, or they come to Asia. There's so many of them, and they come all every year for that matters. We have treated thousands and thousands of them. And I love what I'm doing, and we don't do a discrimination of the rich or the poor. Everyone pay the same price. So it doesn't mean you're rich, you have to pay a higher price. It's one price, standard price. And of course, there are also the poor who can't afford the treatment. Then we have to think of solutions. Sometimes we have to find solutions for them. And this is where donations comes in. Or sometimes we have to come in with our own to treat the patients for free. It depends. If it's life endangering, we must save the life. So that is my experience. This is Dr. Michael McGuinness. She's from USA, he's American. And this is how we treat him. Imagine the photo in 2019 with an open heart surgery and 3 dialysis a month, and he moved on and look at 2022 on the right-hand side. And I have a photo with him just before he left. And a day before that, 2 days before that, when he was having his stem cells, before that, a day, Her Holiness Sai Maa was with this guy too. We are having meal together, and he see the experience of this doctor, American doctor, who has lost everything. He even sold off his successful practice in Los Angeles and took the money to be ready to take care of his life. And today he took all the money to buy resources in Ecuador and build up resource center, and he set up a European Wellness Center in Ecuador now, and he invited me to be his partner there, a small-time partner for him, and he said, you must do it for humanity there, So I go along with the idea. So the last 2 days, I was discussing with Her Holiness here, we must do something here in USA. So it's high time for us to do something to add quality life into your longevity and to make all of us understand better about life, Oh, sorry. So again, this is a Parkinson. I've done so many, and this is a guy who is a billionaire in Shanghai, a billionaire. He has a house which is as big as Your Holiness here, and you'll be surprised. His wife left him despite all the billions, because she cannot stand taking care of him for 10 years. It's so difficult to take care of a sick person. Because if you take care of a sick person, you're more sick than the sick. You know, I realized there are some people who die even before the sick person die off. I saw it in my own auntie taking care of a diabetic patient, my uncle. So I come to realize it is good for us to take care of ourselves first. You take care of yourself, and then you take care of others. But it's good for everyone to be non-selfish, to take care of ourselves and understand ourselves better. We have to change for the better, you know. So he went on with all the steepness, you know, he can't even walk, disappointed in life because the wife left him. So he had to hire 2 nurses to take care of him. And now he's taking care of the 2 aging nurses. You know, that's the other way around. Okay, he's taking care of the 2 aging nurses. And he's happily now playing all he wants. And that's life. And this is American patients. He's a Romanian in Florida. You know, father is doing the business in Florida. They came to Malaysia. I did it for him once, you know, and then the COVID, he can't come. And then he came again. They only have 1 son. He had a very violent behavior. He's an autistic child. I changed everything with him, for him, and he loved what I'm doing very much. Because to treat a patient, you must go into their world. So when I treat autistic children, I have to understand what they want and what they like. So I have experience of treating autistic children once, who will only not talk to you at all or not answer you, but he will be looking at Marvel movies on the internet. And he came to Switzerland to be treated. The mom paid me a lot of money to be treated, and I prepared ourselves, but it's hard to interact with him. So that night itself, I spent 5 hours on the internet understanding what is Captain America and everything. And tomorrow I buy a movie ticket and spend 3 hours watching the movie in German, in Switzerland. It's difficult, but I start a conversation. And with that conversation, which is something he liked, we become close friends for life, and I treated him well. So this is how I always believe you must go into the world. I've done thousands and thousands of autistic children for that matters, okay? Now look at this picture. The boy is 9.5 years old when he comes to us. It's a Down syndrome child. Your face is your intelligence, it's your brain. You don't need to have a handsome face or a beautiful face, but the expression when you speak, the expression from your face itself tells a lot about your IQ. And when we look at the boy expression, his face, and 1 year later, with the treatment of the stem cells of the brain, it changes. So when we look at the face of the children with global delayed development or Down syndrome autistic children, we already know something about the children, even with the cerebral palsy. And this is what we did, you know. Now again, look at this child. Look at her when she was 1.5 years old and when she was 10 years old. It's totally different. There's a lot of pediatric doctors who can't recognize that the child is even a Down syndrome child. This is our experience in Asia, because in Asia we have a lot of Down syndrome children. Why? Because in the Muslim community, you can't do abortion. And a Muslim man have 4 wives and have many girlfriends. So you'll be surprised in a family in the Middle East, where I'm treating a lot of thousands of Down syndrome children, they have a few Down syndrome children or autistic children in the family. They never show it out to the people, but it's already in the family. They stay together, but they are not exposed. So there's a solution where we have to do something about it. So if I can do something for the brain for Down syndrome children, what about for our brain, all of us, which is deteriorating? Obviously, we can do that. So my answer to all the mothers who ask me, Mike, can you make my son more intelligent? I say, if your son is or daughter is less than 5 years old, it's better. And again, if your son is 15 or 16 years old, can you be smarter to a certain extent? Yes, you can still be smarter, because the frontal lobe is only fully developed by the age of 25 and 26, and that is your learning power. So this is an Australian girl paid by the Australian insurance company who came to Malaysia. She was on AIDS, you know, assisted AIDS, and mother had to hold her. In the later part, she walked on her own to a certain extent. There's so many stories to tell, you know. And this is a charge syndrome. We are challenged. When I first brought stem cells to Hong Kong, I was challenged by the medical community. They gave me the most difficult case, which is this child. She can't see at all, confirmed by the ophthalmologist, but I found she has some living tissues in the eyes, and he can't even lift his head, and the grandmother and mother have to take care of him. They live in an environment, Hong Kong is a developed country, but they don't have light. That means they must be very poor. So the medical community chip up the money, and I treat the child at a subsidized price, and he start to respond to light with a torchlight direction. So there was some improvement. But look at the picture, 11 years or 9 years later, he's standing on his own. He can't even stand at that time. And he's standing on his own, and he's with the spectacles. That means he's seeing too, although he's also with dark, thick lenses. So there's a lot of things we do. I've done 8 treatments for that child before that. So if you have any technical information, you need to ask questions, please, you can write to me. I will answer every question as much as I can within 48 hours. Because when you're traveling, sometimes I miss the time and the time difference. I love what I'm doing very much. And I always say, the biggest thrill in a physician life, or for my life, is every morning when I wake up, I see a lot of good messages. I'm improving on this, my son is improving, my daughter, I am getting better. These are something where money can't buy at all. For all the millions, they can't buy all this. So all we want is to turn the hopes into reality. So my encounter with Sai Maa was an introduction by a certain doctor in Florida. He mentioned, he said, Mike, you must contact Her Holiness Sai Maa. Okay? So we did touch base. After that, I was busy. I took a few weeks to contact Her Holiness. Then when we start to talk, we come to realize we have certain same energy and synergies with the cells. She believes so much in the cells, the spiritual part of the cells, and I believe so much on the technical part of the cells, the mechanism of the cells. So if you can combine it together and understand the cell better, we will make a better world for many of us here, okay? So healthspan, lifespan depends on the healthspan, and the healthspan depends on the cellspan. So you must treat at the cellular level, exactly like what she said in her presentations, and I agree totally. But give the right cells. Thank you so much, everyone.